Dengue virus is a silent but persistent threat, lurking in the background of daily life and affecting millions each year, especially in tropical and subtropical regions. Unlike some diseases that make headlines, dengue often spreads quietly, catching communities off guard. Its presence is felt most acutely in places where warm temperatures, humidity, and dense populations create the perfect breeding ground for mosquitoes, the tiny but powerful carriers of this virus. Nearly half the world's population is now at risk, making awareness our first and most important line of defense. Dengue doesn't discriminate, it can affect anyone regardless of age, background, or lifestyle. The risk is especially high in cities and towns where people live close together and where standing water is common, providing mosquitoes with places to lay their eggs. Understanding the scale of the problem is the first step toward protecting ourselves and our communities. Dengue is caused by 4 closely related viruses: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. Each of these serotypes can cause illness, and infection with one does not protect you from the others. In fact, being infected by a different serotype later can actually increase the risk of severe disease, making dengue a complex and unpredictable challenge for both individuals and healthcare systems. Infection with one serotype gives lifelong immunity to that type but only short-term protection against the others, making repeat infections more dangerous. This is why some people who have had dengue before may experience more severe symptoms if they are infected again. It's a unique aspect of dengue that makes prevention and awareness even more critical, as the risk doesn't disappear after the first infection. The virus affects people of all ages, from young children to the elderly, and is spreading further than ever before due to global travel and rapid urbanization. As people move between countries and cities, they can unknowingly carry the virus with them, helping it reach new areas. Urban growth often outpaces infrastructure, leading to more places where mosquitoes can breed and more people at risk. Dengue's impact goes far beyond health, straining hospitals and causing economic hardship for families. When outbreaks occur, hospitals can quickly become overwhelmed with patients, and families may face lost income due to illness or the cost of medical care. The burden of dengue is felt not just in the body, but in the daily lives and livelihoods of those affected. Public health officials worldwide are working tirelessly to control its spread, launching campaigns to educate communities, eliminate mosquito breeding sites, and improve early detection. But knowledge and prevention start with you. Simple actions, like removing standing water, using mosquito nets, and staying informed, can make a big difference in reducing the risk of dengue in your home and neighborhood. In this video, we'll break down what dengue is, how it spreads, its symptoms, and how you can protect yourself and your loved ones. We'll explore the science behind the virus, the role of mosquitoes, and the warning signs to watch for if you or someone you know becomes ill. We'll cover diagnosis, management, and most importantly, practical steps to prevent infection. From recognizing early symptoms to seeking timely medical care, and from using repellents to supporting community cleanup efforts, you'll learn how to take action at every level. This isn't about fear, but about being prepared. By understanding the risks and knowing what to do, you can help protect yourself, your family, and your community from the silent threat of dengue. By the end of this video, you'll have a clear understanding of dengue and the tools you need to keep your loved ones safe. Let's get started on this important journey together. Dengue fever, a serious viral illness, begins its journey with a single bite from the Aedes aegypti mosquito. This tiny insect, often overlooked, is the main carrier of the dengue virus. When it lands on your skin and pierces it with its needle-like mouthpart, it can inject the virus directly into your bloodstream, setting off the infection process. The Aedes aegypti is not just any mosquito. It's a highly efficient urban dweller, perfectly adapted to city life. Unlike other mosquitoes that prefer rural or forested areas, this species thrives in crowded neighborhoods, apartment buildings, and even inside our homes. These mosquitoes breed in clean, standing water. Think flower pots, tires, and gutters around your home. Even the smallest puddle or water-filled cap can become a nursery for hundreds of larvae. That's why urban environments, with their abundance of water containers and places for water to collect, are hotspots for dengue transmission. The cycle of infection starts when a mosquito bites a person already infected with dengue. The virus enters the mosquito's body, where it multiplies over about a week. After this incubation period, the mosquito becomes infectious for the rest of its life, able to transmit the virus to every person it bites. Unlike many other mosquitoes that feed at night, Aedes aegypti is a daytime feeder. It's most active during early morning and late afternoon, often biting multiple people in a single session. This behavior allows the virus to spread rapidly, especially in densely populated areas, and is a key reason why outbreaks can escalate so quickly. It's important to remember that dengue isn't spread directly from person to person. The mosquito is the essential link in the chain. Without the mosquito, the virus cannot move from one human to another, making vector control absolutely critical. This makes mosquito control both a challenge and an opportunity. Communities and individuals must work together to reduce mosquito populations, using methods like spraying insecticides, using bed nets, and cleaning up potential breeding sites. By targeting breeding sites and preventing bites, we can break the chain of transmission. Covering water storage containers, applying mosquito repellent, and removing standing water from our surroundings are all simple but powerful actions. Every household action counts in reducing the risk. Regularly checking for and emptying stagnant water, even from small containers, can make a big difference in keeping your family and community safe. Remember, no mosquito, no dengue. Prevention truly starts at home. By making our living spaces less inviting to mosquitoes, we can protect ourselves and our loved ones from this dangerous disease. Let's explore the practical steps you can take to safeguard your space and join the fight against dengue. After a person is bitten by a mosquito carrying the dengue virus, symptoms usually begin to appear within 4 to 10 days. This period is known as the incubation phase, and during this time, the virus multiplies in the body, often without any warning signs. Many people may not realize they have been infected until the symptoms suddenly start. Dengue fever tends to strike quickly and with intensity. The most common initial symptom is a sudden, very high fever, often reaching up to 104 degrees Fahrenheit. This is usually accompanied by a severe headache, which is often felt behind the eyes. Many people also experience intense pain in their muscles and joints, which can be so severe that dengue is sometimes called breakbone fever. These aches and pains can make even simple movements uncomfortable. Along with pain, overwhelming fatigue and weakness are very common. People with dengue often feel extremely tired, sometimes for days or even weeks, making it hard to get out of bed or complete daily tasks. This exhaustion can linger even after the fever subsides, affecting work, school, and family life. Another symptom to watch for is a skin rash, which may appear a few days after the fever starts. The rash can look like small red spots or patches, and sometimes comes with mild bleeding under the skin, known as petechiae. This rash can be itchy or uncomfortable, and it's a sign that the virus is affecting the blood vessels. Nausea and vomiting are also frequent symptoms, and they can make it difficult to keep food or fluids down. This increases the risk of dehydration, which is especially dangerous for young children and older adults. Staying hydrated is very important if you suspect dengue. It's important to remember that symptoms can vary widely. Some people, especially children and teenagers, may have only mild symptoms or none at all. Even if they don't feel sick, they can still carry the virus and spread it to others through mosquito bites. Recognizing these early warning signs is crucial. If you or someone you know develops a high fever with severe pain, rash, or persistent vomiting, it's important to seek medical advice right away. Early detection can help prevent complications and ensure proper care. Don't ignore severe abdominal pain, ongoing vomiting, or signs of bleeding such as nosebleeds or blood in the stool. These can be signs of severe dengue, which requires urgent medical attention. Acting quickly and getting the right care can make all the difference in recovery from dengue fever. Stay alert to the symptoms and don't hesitate to reach out to a healthcare professional if you're concerned. Most dengue cases resolve in a week, but some progress to severe dengue, a life-threatening emergency. The danger often arises as the fever subsides during the critical phase. Plasma leakage from blood vessels can cause shock and organ failure. Warning signs include severe abdominal pain, persistent vomiting, restlessness, and bleeding. A rapid drop in platelets increases bleeding risk. Watch for nosebleeds, gum bleeding, or blood and vomit. Fluid buildup in the chest can make breathing difficult. Severe dengue can escalate quickly. Immediate hospital care is vital. Know the warning signs and act fast. Timely intervention saves lives. Don't wait. Seek help if symptoms worsen. Doctors start with a clinical evaluation, asking about symptoms, travel, and checking for classic signs. Because dengue mimics other illnesses, lab tests are essential. Early in the illness, PCR or NS1 antigen tests detect the virus in blood. After a week, antibody tests, IgM, IgG, show if the body is fighting dengue. A complete blood count tracks platelets and hematocrit, key for spotting severe cases. Daily monitoring helps guide treatment and catch complications early. Accurate diagnosis is crucial for proper care. If you suspect dengue, get tested promptly. There's no cure for dengue. Treatment is supportive. Rest, hydration, and fever control are the mainstays for mild cases at home. Drink plenty of fluids to prevent dehydration, avoid caffeine and alcohol. Use paracetamol for pain and fever, never aspirin or ibuprofen as they increase bleeding risk. Watch for warning signs of severe dengue. Hospitalization is needed for severe cases, with IV fluids and close monitoring. Blood or platelet transfusions may be required if bleeding occurs. Early medical attention is key to recovery. Don't self-medicate. Follow medical advice. Supportive care saves lives. The best defense against dengue starts at home. Eliminate mosquito breeding sites. Check weekly for standing water in containers, gutters, and plant trays. Dispose of or cover items that collect water. Scrub water storage containers weekly and keep them tightly covered. Use larvicides if covering isn't possible. Maintain your yard, trim grass, clear debris, and flush out water-holding plants. Even small amounts of water can breed mosquitoes. Consistent action reduces risk for your family and neighbors. Community effort multiplies the impact. Prevention is everyone's responsibility. Even with breeding control, some mosquitoes remain. Personal protection is vital. Wear long sleeves, pants, and socks, especially during peak mosquito hours. Choose light-colored, loose-fitting clothes. Use repellents with DEET, picaridin, or oil of lemon eucalyptus. Apply to all exposed skin. Reapply after sweating or swimming and use age-appropriate products for children. Install and maintain window and door screens. Sleep under mosquito nets if needed, especially for children or the sick. Protecting yourself also protects others from the spread. Layer your defenses for best results. Dengue is a serious disease. Don't underestimate it. Whether you live in or travel to risk areas, stay informed and prepared. Community and individual action together make the biggest impact. Clear standing water, use protection, and encourage others to do the same. If symptoms appear, seek medical care early, especially during the critical phase. Watch for warning signs and act fast. Knowledge is your best defense. Put it into action. Protect yourself, your family, and your community. Together, we can reduce dengue's impact. Stay vigilant, stay safe. Thank you for watching. Share this knowledge and help stop dengue.